एवरीवन वेलकम बैक टू माय यूट्यूब चैनल। आज की वीडियो में हम बात करेंगे इंटरमीडिएट न्यूमेटिक कंप्रेशन। देयर हैज़ बीन मच डिबेट कंसर्निंग द इफेक्टिवनेस ऑफ इंटरमीडिएट न्यूमेटिक कंप्रेशन डिवाइस पंप. It should be mentioned that the significant technological advances in the compression device design have been made in the recent years, such as multi-chambered compression sleeves that are programmable and controlled by the computer. However, in the spite of these advances, some experts contend that the intermediate pneumatic compression device should only be used in junction with the conservative treatment method if they are used at all. Part of the concern is that the compression pump may move water but not protein as found in the lymphedema from the interstitial spaces. Another problem with the intermediate pneumatic compression device is that the actual pressures applied to the patient which may be much greater than the intended pressure selected by the therapist. In one study using a commercially available pump, actual pressure in the chamber were up to 80% higher than the target pressure. For example, if the target pressure was set at 100 mmHg, a much higher pressure of the 141 mmHg was actually delivered. High pressure in the 70 to 100 mmHg range can be damage lymphatic vessel in a few as 3 to 5 minutes when applied during the forceful massage. Therefore, it is very likely that the high pump pressure could damage the lymphatic vessel. Another concern is that if pumps are used as the sole method of intervention, the edema is moved proximally, which in the lower extremity can result in the genital lymph edema. In fact, one retrospective study found that 43% of the lower limb lymphedema patients using the compression device at a lymphedema treatment facility developed genital edema. In contrast, the other study using the subject with the lymphedema report beneficial results using the intermittent pneumatic compression alone or as an adjunctive treatment along with the conservative treatment method. New developed programmable pneumatic compression device specifically designed to treat the lymphedema patient have also shown promise as an adjunctive treatment. Clearly, more research is needed to bring clarity of the controversial method. Now we will talk about conservative method, manual techniques to treat the lymphedema. First developed in the 1989, Alexander von Wimwanter, a German surgeon, afterward were largely forgotten. Dr. Wimwanter's method include the meticulous cleanliness, compression, massage, and exercise. In the 1930s, the Danish couple Emil and Stride Warder developed the manual technique called the manual lymph drainage (MLD) to treat the lymphedema by moving lymph in the desired direction. The named their system of technique complex decongestive physiotherapy, which is the most common method of conservative lymphedema treatment in the North America. In the 1970s, the Horgan physician Michael and the Ethel Folge incorporated the Warder MLD technique into a comprehensive lymphedema treatment program now called complete decongestive therapy. CTD occur in the two distinct phases that consist of MLD, compression, exercise, and specific skin care. Johan and Jode classified Smith from Australia and Albert and Olivier Leroy from Belgium have contributed significantly to development of the conservative treatment technique, as have many others. The nomenclature concerning the naming of the conservative method for treating lymphedema has varied considerably over the years, and in the lymphedema has varied considerably over the year, and in the latest 2009 consensus document of the International Society of Lymphology, the term combined physical therapy is advocated. However, in North America, the term CTD is widely used and used in this chapter. Europe has a number of the specialized lymphedema clinics that carry to the patient with the disease of the lymphatic system, and their insurance plan have historically allowed for the twice daily treatment over a course of the 4 to 6 years. However, in the United States, most lymphedema patients are seen on an outpatient basis and are limited to the once per day treatment during the work week because of the reimbursement issue. In the United States, patients with lymphedema of the upper extremity can offer treatment for 3 to 4 weeks, whereas the typical treatment length for the lower extremity lymphedema patient is approximately 4 to 6 weeks. Of course, treatment times are dependent on the number of the limbs involved, the severity of lymphedema, and the presence of comorbidities such as lymphedema and chronic venous insufficiency. So guys, if you have any query about that, you can ask me in the comment section. Thank you so much for watching the video.